Fundamentally, the clinic should be able to lay out exactly what you should expect that you'll need to have in a cycle. So if I was starting IVF for the first time and I was comparing clinics and I was faced with a price list, what are the things that I should see on a price list that I would expect to have in a standard cycle that I can't do a treatment cycle without? Patients are often really overwhelmed when they come to compare clinics and they're trying to work out, what am I going to need to pay? What is included in one clinic and what isn't included in another? And I really understand why it's very overwhelming. What we try and do at the Evewell is give you a kind of PDF document for whatever treatment cycle that you are interested in. So if we're talking about IVF, we will try and price out for you what you would expect from an IVF cycle from beginning to end, on average. What you can then do is use that document to compare with other clinics and pull out those same line items. The type of things that are going to be really, really standard, usually because they're procedural or regulatory, are things like a fertility review at the beginning for you to assess what treatment is recommended for you, how many cycles of treatment you might need, and help the doctor make those recommendations. If you are coming through for treatment on your own, or if you're coming through for treatment with a partner, you or your partner are going to need a virology blood test, which is a regulatory requirement from the HFEA. That is really standard, no matter where you're going to go. Then we move on to the kind of treatment side of things. There'll usually be an IVF package. There might be an additional fertilization method like ICSI that may or may not be included as part of that, and will be something that your doctor will recommend you to have. You then have all of the kind of lab work. So it might be things like blastocyst culture, whether the clinic uses time lapse. All of those things should be laid out for you as whether you're going to need them or not. There will also be a few differences in whether you are having a fresh transfer or a frozen transfer moving forward. But fundamentally, the clinic should be able to lay out exactly what you should expect that you'll need to have in a cycle. At the Evewell, we try and give you a sample costing upfront, even before you see a doctor, so you can understand what might be coming up for you. And after you've seen the consultant, we will make a tailored and personalised treatment plan for you and send you the costings specifically for that. Patients often, when we send them to them, will say, oh, but this is the same document you sent before. And I think that's just testament to how accurate our sample costings are at the beginning, that it will often be the exact same line item that we suggested that you may need going forward. One thing that I was actually caught out on was how much the medication actually can be, and how the clinic didn't even tell me about the medication. They just gave me a price list and they said, right, this is your IVF cost. And then throughout the cycle, obviously there's more additional costs, things like the blood tests and the medication. Do you make allowances for that at the beginning? Do you communicate that to the patient up front so they know roughly what they're going to be spending? Medication is a little bit tricky. We definitely don't sell medication ourselves at the Evewell, so we allow you to source that from wherever you can find that cheapest. We do have pharmacies that we work with, and using their prices, we try and give a good range of what you can expect to pay. You are not tied to using the pharmacies that we have. In terms of blood tests, because your treatment plan with the Evewell is really bespoke, again, we try and give you a budgetary range. It's really hard to say exactly what you will need. Some people might need 2 blood tests, some people might need 5, but we try and give you the range to budget for. And if you're budgeting for the upper end of that range, you just might have a nice surprise when it comes to the end of the cycle. How about multi-cycle packages? So at the Evewell, we don't offer multi-cycle packages. We want to try and achieve the outcome in as few cycles as possible. And we never want somebody paying for more treatment than they need and then feeling like they have to have additional treatment in order to get value for money. We would rather charge per cycle and then try and optimize those cycles to get your results in as few cycles as possible.